Colleagues and friends, Assalamu alaikum. We are just a week away from the 4th Bariatric Surgery Masterclass to be held in Peshawar. I am Professor Mumtaz Meher. I'm a laparoscopic and bariatric surgeon at the South City Hospital in Karachi. I'm actually looking forward to being in Peshawar. And for that matter, whenever there's an event, a scientific event, surgical event in Peshawar, I always look forward to being there. The culture is different. I have a lot of friends over there. People who are managing these events are qualified and competent, and they work with a team that is always very strong, and that is very impressive. The scientific program is always very good. This event has been organized by Professor Mumtaz Meher. Everybody knows about him. He's competent. He leads from the front. He's very capable, and he performs complex surgical procedures. Laparoscopic surgical procedures. The best part is that he's doing all this at the Khyber Teaching Hospital, which is a nursery for training young surgeons. And this is also a good opportunity to see how things work over there. Because whatever we do, we learn from each other and emulate whoever is doing a good job. This event has been endorsed by the POMSS, the Pakistan Obesity and Metabolic Surgery Society. And when it does that, it knows that the scientific content is high quality, good quality, and it has a purpose, an objective that it will achieve. And I'm sure that will happen. When I was learning bariatric surgery, I had to travel out of this country to watch what you're going to get to see next week. And that meant a lot of money spent and travel and being away from work. But now all this is happening over here, and the standard of surgery is exceptionally good. It is an opportunity for everybody, whether you're at a junior level or at a senior level. You get to meet your colleagues and contemporaries. You get to know what they are doing and how they are doing it. We use the word tips and tricks. I don't like that term. I think what you learn is maneuvers. Surgery means maneuvers. You learn maneuvers as to how do they overcome a certain objective in surgery. You'll get to see senior surgeons who will show you how they do a Roux-en-Y gastric bypass, how they do a mini gastric bypass, how they do a good sleeve gastrectomy, and then there'll be opportunities to ask questions and learn. Bring a notepad with you and note down how a certain surgeon is doing what he is doing. What I feel is that in the KP chapter, the progress is so good that going there, you come back with something learnt new. And the other important thing is that most of our guidelines are set by people in the West. We have to set our own guidelines. And going to Peshawar, I try and find out in our culture, in our type of people, with the kind of food culture we have, how do we cope with the problems? How do we deal with them post-operatively? What do we do with people who are not compliant? And these are all learning points that we cannot get from anybody else who is not familiar to our culture. I feel you all should take time out, come visit, come make friends, watch the videos, watch the surgeries, learn techniques, and most of all, get to meet the experts with whom you can exchange ideas. So come prepared with your questions, with your case scenarios, and discuss with the experts when you meet them over tea, over dinner, or socially otherwise. I also look forward to being there, and I hope to see you there on the 2 days of the 18th and 19th of November. Khuda Hafiz.